Hi guys, it's me, Gareth Williams, Specialist Orthodontist. If you're new to the channel and you like these videos, please subscribe. It helps me get this information out to more patients. And if you think anything would be useful for you, just leave it in the comments as a topic and I'll be sure to make a video. So I want to talk to you today about gum disease or periodontal disease. Periodontal disease is the umbrella term for anything that ranges from very mild gum disease, which most people have at some point in their lives and most people have on pretty much a weekly basis. Gingivitis is the other term for it, which is a mild or moderate inflammation of the gum line where the gum sort of puffs up and bleeds readily, all the way down to severe periodontal disease. The thing that characterizes this continuum of a disease process is bleeding of the gums spontaneously or sometimes on probing with a blunt probe with a ball on the end, bad breath, a bad taste in the mouth, and then towards the severe end, loose teeth. When patients come to see me, it's incumbent on me to check that the teeth are safe to move by performing a BPE, which is an acronym for a basic periodontal exam. And what we do as part of that is we run a blunt ball-ended probe around the gum line of all of the teeth to determine if there's any loss of attachment. Loss of attachment means areas where the gum has lost its close binding to the neck of the tooth. If that has happened, that's a sign that the tooth isn't stably held in place by the gum and the bone underneath. And the difficulty when we move teeth that have already got an unstable foundation is they become permanently loose during treatment. So it is quite a serious survey that we're performing there. We bolster that clinical diagnosis then with an x-ray that really all patients need before teeth are moved. In the first x-ray we can see very little to no bone loss, and the second more severe bone loss, resulting in loose and lost teeth. This is a table showing our gum measurement index, the BPE. If the BPE is less than 3, so 0, 1 or 2, often that's improvable by simple oral hygiene measures. So I'll show you how to brush the gums, send you a video perhaps on how to brush between the teeth, which is one of the most important things that you can do for any form of periodontal disease. Brushing between the teeth with a TP brush is the most commonly not done thing. If it's a BP of less than 3, generally I can counsel you through those sorts of improvements. If we're talking 3 and above is where you lose bone generally around that tooth, and that's when it becomes unsafe to move those teeth unless we know for sure that that bone loss has now stabilized, sometimes regrown, but at the very least isn't continuing to be active. And for that you generally need to see a specialist periodontist. So just like I'm a specialist orthodontist, so I'm a general dentist who's done additional training for 12 years of training to become a specialist orthodontist. So just like I am a specialist orthodontist, there are specialist periodontists who deal exclusively in the management of gum disease. They are different to a hygienist. So a hygienist is an ancillary or an auxiliary qualification, which are often dental nurses that have trained further and had a diploma in the management of gum diseases. For the most part, hygienists are mainly to deal with BPs of 1s and 2s, or 3s and 4s and stars under the prescription of a specialist periodontist. What you've got here is different tranches of responsibility depending on how serious the condition is. And as gum disease gets more serious, you're edging away from a hygienist, either towards a general dentist with a special interest, so that might be a dentist who's had more exposure to gum disease than another general dentist, or for more severe things, a specialist periodontist, and they are the cream of the crop in dealing with gum conditions of any kind. So if you've got BPEs of 3s, 4s or stars, I will recommend that you see a periodontist, and then I will need from them what we call a clearance. Essentially an MOT where they say, "Dear Gareth, it is safe for you to move these teeth. Either I want to review this patient while the orthodontic treatment is ongoing, or I've discharged back to your care and it's totally stable." When I've got that letter, we then move the teeth. The biggest difference that can be made with gum disease is patient personal responsibility, and sometimes patients don't like hearing it, and there's a lot of reasons why people fall into this trap. Quitting smoking is the best thing you can do for gum disease. Second to that is using brushes between the teeth. TP brushes, Tandex brushes, whatever the brand, it doesn't matter, but getting a brush between those teeth, that makes such a massive difference. And there's a whole range of reasons that I hear that people can't use them. So they'll say the teeth are too tightly packed together, which is generally incorrect. Generally, it hurts. Yes, it does. You just have to sort of get over that until the gums heal. It's uncomfortable. I don't like that the gums bleed. I'm afraid it's a little bit like personal training in this regard. It's no pain, no gain. So you just have to sort of push through that, or you will always have this problem. And once you can reframe your thoughts and understand that what you're doing is a good thing for your gums rather than a bad thing, you'll never look back, and you just won't have gum problems anymore. It'll be that simple. The bad breath will go, the bad taste will go, you won't find blood when you're eating an apple, you won't find blood on your pillow. Okay, I hope that helps. Thank you for listening. Bye now.